alcohol.
We're back with Dr. Fisher, and we're here to talk about medications and anti-anxiety medications, antidepressants, and again, the relationship with these to also, alcoholism and drinking and that kind of thing. So let's just start out about talking about anti-anxiety medications, the various types and what they do, if we know what they do, and why they work, why they don't work, and problems that they might have.
Well, this is a huge topic, okay, and I want to stick to things that we can sort of cover in a limited time frame, and that'll be understandable to most of our viewers here. We couldn't live without anti-anxiety medications in the medical business, okay, because initially, before people can, in my opinion, learn to cope with anxiety through non-pharmacologic means, they sometimes need medication to calm them down enough to get them to learn what they need to learn so they're not anxious, if you understand what I mean. Mm-hmm. So the medicines, I think, are a wonderful temporary adjunct to cognitive or behavioral care, which is what we're offering them here. So I don't have a problem with someone who's really anxious, non-functional, can't even pick up a book and read it because they're so nervous, taking medication for a brief time period.
And how brief?
Well, here's the problem comes when people think, okay, we've solved the problem. I took the pill, I feel better.
Right.
Why do I need to do this? Why would I want to do this? I'll just take the medicine. Well, as we know, with medicines that tend to be habituating, by definition, they require higher and higher doses over time to achieve the same effect. Mm-hmm. And people with anxiety are, unfortunately, often prone to self-medicate. And whether they do it with alcohol or whether they do it with medications that we prescribe them is insignificant. I mean, they're abusing the medicines either way. So it's very difficult sometimes to get an individual to stay on a particular dose of medication indefinitely, because when one little thing happens that triggers their anxiety, rather than cope with it, they'll look for the answer in a pill bottle. And so they end up taking another pill.
Let me just interrupt you for a minute, a couple of things. I think that's why I have a problem with how easily people are, and quickly, people are prescribed medications because that's the easy solution. As we talked about before, they've got 10 minutes with their family physician or whoever they go to, and they give them this medication for a somewhat quick fix with no real skills. But what I see that happens is it takes away their motivation then to learn skills like this.
And unfortunately, in the limited setting that we have in primary care, it's often the only solution. And in some cases, even when there is additional counseling available, the number of visits is limited by the insurance plan, or the individual who you'd like to send the patient to isn't on the list.
Yeah.
And so you're sending them to another provider who might not be used to working with anxiety the way your favorite therapist may be, and on and on. So there are all sorts of roadblocks set up that make us stumble in the course of proper treatment.
Well, the other thing is, too, I know for a fact that people like me don't want to take medication. You know, most of us are afraid of it. And so when someone says, here's the solution to your problem, we're kind of like this. And that's good and that's bad, because if your problem is, as you said, if you're so bad you cannot function, if you're so bad you can't even hear the skills we're trying to teach you, then maybe you do need to consider a very mild dosage of an anti-anxiety or antidepressant medication, and hiding it. They're hiding their anxiety. Maybe they can do everything, but they just have generalized anxiety through the day, or maybe they can do everything except get on a plane, whatever it is, or speak in front of people. And to me, it's a shame that they have to take that pill just to get on a plane, because there's a better way, and that's what this is all about. But do you think that antidepressants are less harmful or less of a concern? And are there antidepressants that work for anxiety as well as depression? Oh, sure.
As a group of medications, I write antidepressants to anti-anxiety agents probably 20 to 1.
Okay.
The net effect of antidepressants is actually to change the chemistry in the brain back to a more normal functioning. Used in the right person are wonderful, and they can be absolutely life-saving, because after all, untreated depression can occur in the form, but it is possible. So this is a disease that needs to be taken very seriously. And the medicines we have for depression, we have a dozen medicines for depression these days, and they're wonderful, and they have way fewer side effects than the medicines did 7, 8, 10 years ago. They're easier to take. They're just much simpler in form, and they're extraordinarily effective.
Well, I know, for example, and I'm just going to name a few, there are different categories and different families of medications, and I know we're not going to get into all of them. But, for example, Zoloft, Prozac, I don't know what family do those fall
Well,
under?
those are serotonin reuptake.
Okay, and I know that supposedly they work for obsessive thinking.
Yes, they help that. It's a big time.
So I do think it's important when you go to your doctor to say to him or her, this is my problem. I mean, if you're considering a medication, there are certain antidepressants that work better than another one would.
That's right.
What are the two?
And there are other ones that work better for panic attack.
Okay. What would some examples of those be, just for the sake of it?
Well, do we want to name names? I guess Paxil would be a good medicine for people with depression and panic attacks.
Okay.
Older medications would include Tofranil.
Okay, yeah.
Depending on what your needs may be.
What are the categories of antidepressants?
Well, there's tricyclic antidepressants, there's MAO inhibitors, there's SSRIs, selective serotonin uptake inhibitors.
Now, MAO inhibitors are used most often for,
well, they're really used in cases where people don't respond to other forms.
They're pretty strict.
Well, they have some restrictions as to what you can eat when you're on those. You have to be very careful what you're eating.
I think the interesting thing, too, is make sure when you talk to a doctor about your depression that you're specific about your symptoms, because there are some types of depression that you don't want to take certain antidepressants for, if, for example, I was been on Prozac, they should have been on something else, probably lithium.
Right.
And so it's just important that you're on the right medication for the right problem. So you have to be really specific when you're talking with your doctor about symptoms.
Yeah, you have to be really honest. If you're just honest,
that's a good word.
And he hears everything, then he can make the right choice for you.
So the whole key here then is keep an open mind. If depression is going to help you, if you're really having a hard time functioning and coping, and you feel that's anxiety, then talk to your doctor about that. And there are different types of anti-anxiety medicine. What about Valium? Do people still use Valium to treat anxiety, or should they be?
Well, they do. I haven't used it for that very much.
Yeah.
There are medicines actually that are more effective for panic attack than Valium is. Valium was sort of the prototype anti-anxiety tranquilizer drug early on in the 50s and 60s, depression, and some of the newer tranquilizers don't have that feature.
And they also they've used for a while been using anti-seizure medication for anxiety disorders like Klonopin. Is that correct?
Well, yes, that's been shown to work as well.
How does that work? Do we not know for sure?
Don't know for sure. Don't
Isn't
know for
that
sure how
amazing?
any medicine works. Well, like just the human body at some level, if you keep asking, well, the medicine does this. Well, how does it do that? Well, it does this. Eventually, when you keep asking those questions, you'll run out of answers.
Okay, let me ask you a real direct, honest question. If someone's been going somewhere for 3 years and they went from 1.5 milligrams of medication to now they're taking 3 milligrams of that medication, and they've been going there for 3 years and they're still having problems with anxiety.
Well, if you do this,
right.
You should be moving along. You should be improving in your anxiety, not just managing the symptoms. And that's why
That's perfect. You should be learning how to alleviate, if not prevent, that's a good word, the symptoms on your own, so that eventually you can start cutting back. However, always cut back with your doctors.
There should be a growth pattern here. You're not going to the doctor, hopefully, to maintain your anxiety level. You're going there to, in the long run, get better.
Right.
We don't go to just, to improve our sinus infection. We go there to get rid of our sinus infection.
Analogy.
Okay?
Right. And again, we cannot stress this enough. If you are thinking at all about this thing, show them the program, show them the tape, say, hey, look, I think I can cut down. I'm learning some skills. How do I do that? Always work with your doctor. Don't do it on your own. Because, you cut back on some of those medications and you can have some pretty serious side effects. So go to your doctor, ask them the correct way to do it, right? Well, we have to talk about drinking and depression and anxiety. I know I grew up in a family where my father was a drinker, and I know for a fact that he had anxiety, and I also know that he was depressed. And I also know that he didn't know it, and they didn't know it back then. And I can remember him getting up in the morning and doing in a case of Rolling Rock, and on top of taking Valium. And yet, he didn't know any better, because they had so few answers back then. They just thought, well, this man's stressed out. Let's give him Valium, help him calm down. And I don't even know if they asked him, are you drinking alcohol? And he didn't have any coping skills at all. And I know that I'm genetically prone to, that type of problem. So I'm very aware of that, although I've never been a drinker, because I was one of those people that my anxiety made me feel so out of control that if I drank, I felt more out of control. And so I don't drink much. There was a time I just wouldn't drink at all because it made me feel spacey. But now I can have a glass of wine with dinner and it doesn't bother me. But I see, now that I'm so attuned to it, I see people who will not go to a social event unless there's alcohol present. Or, they will sit at lunchtime and do a martini. And I'm thinking, wow.
Or two.
Or two. And I think, how can they function? And so what do we do? How do you know when you are self-medicating with alcohol?
Well, first thing we need to make clear is that before you begin any program of treatment for anxiety or depression, you need to be not drinking alcohol, okay? Not abusing alcohol.
Not abusing alcohol.
And that's really, the treatment of alcohol abuse is an entirely separate issue, which we're not going to discuss today. But clearly that's the number one thing, is to stop drinking or fix the drinking problem before you try and do anything else, because that drives paramount over that.
I wonder about that, because I think a lot of people drink. I think my father drank because he was anxious.
Well, there's no question. Well, we'll get into this. There's no question that's why one of the reasons they're drinking, other than the fact that they have the genetic predisposition to consume alcohol to excess. The average person who's using alcohol excessively, in my experience, is suffering from depression and usually anxiety both. And if you can reduce their alcohol intake to a more normal level and not an excess of 2 drinks a day, that usually clears their brain enough to be able to learn some coping skills. So you sort of do this in conjunction. I mean, I've had people come in to see me, and this is not an exaggeration. As a matter of fact, several weeks ago, a man came in. He was about 37 years old, using over a 6-pack of alcohol a day, about 18 cups of coffee a day, and nearly 3 packs of cigarettes a day. Okay?
And he wonders why he feels bad.
Well, he was just starting to feel a little tired, and he wasn't very effective at work, and he wasn't getting the things done he wanted. He wasn't meeting his life's goals. But he recognized that. He didn't want to just kind of end up in the dumper. He was trying to make himself better, and he was involved in a new business, and he wanted to improve himself in that area. And so the first thing we did was cut back on his alcohol, all right, because that, of all those things, immediately the first thing we did was cut back on his caffeine, because that was the easiest thing to do of all those three. After we got his...
Easier than alcohol
yes.
and cigarettes,
yes,
caffeine.
Right, because we reduced his coffee intake slowly over about a 10-day period down to zero. Substituted decaf. He was really tired after we did that, but we substituted decaf coffee and gradually got him off coffee over about a 10-day period. So about 2 cups a day over 10 days was getting him down to zero. We then went to the alcohol, down from a 6-pack a day down to where he's at about 2 beers a day right now. And that was difficult also. And the third thing we'll do, which will be the most difficult of all those, is the nicotine, because nicotine is, in my experience, more difficult to stop than either caffeine or alcohol.
That's interesting.
Smokers just have a heck of a time getting off this. And so he's seeing things that he didn't see before. He's visualizing goals that he didn't have. He has plans that he didn't have, and he can sort of see the light at the end of the tunnel now, whereas before it was just a long, continuous tunnel.
And part of the reason that he couldn't see the end of the tunnel is because he was so chemicaled out that he couldn't think clearly.
His brain, it's hard enough in this life and in this country, with all the stresses that some we put ourselves under, but a lot that we're sort of exposed to externally. It's hard enough to really get it together and make things work. And if you consume drugs or alcohol in excess, you have no chance. And people who consume drugs, think they can handle it. They think, this stuff about you not using cocaine or not using alcohol or not, it's for somebody else. I can handle this. I mean, I've always been good. But the problem is they're thinking that before they do it. And they don't know what it's like. And by the time they're into it, it's too late. And they're backed into a corner, and they need professional treatment for these problems.
Don't you think a lot of it is about making a real conscious decision that you want to change?
Sure.
Because I can't imagine, like my father, I people with drinking problems, okay, we're going to cut you back on your alcohol. He's like, sure you are. You really got anxiety. The ones that we've worked with, is they seem to want to get better.
Well, it's painful.
Mm-hmm.
See, the thing is that it's not necessarily painful for some people to drink because other people help them do it, as we know, okay?
And it's socially acceptable.
That's right. That's right. And they feel better when they drink. But with anxiety, number one, it's not very socially acceptable. And number two, it hurts a lot. It's a very painful condition. It's like having a headache that won't go away. And people will work to getting rid of it. And so in some ways it's easier to treat.
I think you just made a great point. I think if people recognize themselves as people who have an addiction problem, and it seems to me that there seems to be a personality type that's more likely to have addiction problems, whether it's an addiction to sugar, have an addictive personality type, then you need to be aware of it, and you need to make a conscious effort to break that bad habit and that addiction. And I think what you're doing with this guy is saying, all right, you're drinking 10 cups a day, let's go down 1 cup, down to 9 cups, then the next day we'll cut down 2 cups. I think that's a really great idea. It's about, moderate. We try to with alcohol, cigarettes, and sugar. And I found that with my little boy when I took him off the sugar. I took him off of it gradually. And, oh, boy, he was so mad at me when I started taking him off that sugar. And if you are a support person of a loved one who has anxiety, you might be enabling them by going and getting them that extra glass of wine or buying a bottle of wine at dinner time instead of 2 glasses of wine. So you can make a difference. It's a choice that you make. I remember when my husband and I would go out to dinner, he would order a bottle of wine. And he's not an alcoholic, but he would drink, 2/3 of the bottle of wine, and I'd have a glass. And I'd say, David, why do you order a bottle of wine? Let's order a glass. And you're right. And it was just that make. And sugar, we got to get you off the sugar. We're going to cut you down gradually. He was very mad at me. He would say mean things to me. And I would say, Sammy, I love you. I want you to be happy. I want you to feel calm. Mommy loves you. And I'll tell you, after a week of being completely off sugar, he's just this loving little, calm, controlled little boy. Mommy, I'm never going to eat sugar again, which of course he will. But he understands why I did it. And so that's what you have to think about. I think it's a gradual thing, and it's a self-love thing, and it's a support thing. If you're a spouse or, a support person watching this, it's a joint effort. It's not going to help it's not going to help your spouse if you're giving them their cup of coffee in the morning and giving them that sugar bowl of cereal. So it's all about, moderation and then gradual elimination, if not, minimization. Is that right?
That sounded
that
right to me.
Sense?
Yes, it did.
Okay, just before we end here, I do want to say just a few brief words about depression, because this program is about anxiety and depression. And I don't know, it's almost like it's okay to have anxiety, Anxiety's okay because, it's an energy thing. But depression's not okay. Depression's scary. Depression's shameful. Depression is, like you said, severe depression can lead to suicide. Well, we're talking about severe depression, folks. We're not talking about the depression that many of you have that goes along with anxiety. But depression is something that people don't seem to be willing to talk about and even be willing to admit. And I think we need to eradicate that whole misconception about, mental illness and, the whole, like the DSM, is it 4 now? Diagnostic and Statistical Manual for Emotional and Psychological Illnesses and things like that. I mean, it used to categorize anxiety as a mental illness. And I think what we need to realize is, thank God we do live in the 1990s, because there are a lot of wonderful medications out there. And even if you suffer from something as significant as schizophrenia, there are medications now that can help people almost live normal lives or productive lives where they couldn't have 20 years ago. So don't be afraid to talk about and admit and ask questions about depression. Because you know what? I remember there was one psychologist that I was talking to one day, and he said, I think everybody would do better off if they were on Prozac or something like that. And I think he was just trying to say that I guarantee you at one time or another we're going to all feel depressed or anxious. And it's not something we need to be ashamed of. In fact, it's something that we need to...
it's part of the human condition.
Right.
Okay, it's part of being alive in this century is to feel stressed out, sometimes depressed, and sometimes anxious. And it's nothing to be ashamed of. What's needed is not for everyone to be on Prozac.
That's right.
But for everyone to possess the skills to cope with both those problems.
And that's what this program does so beautifully.
That's right.
Thanks for joining us again.
My pleasure.
Always good to see you. Hi, we're back, and we're here tonight to talk about medication. And medication is a very controversial subject. I think what our goal is tonight is to show you that indeed if you're on anti-anxiety medication, there's a good chance that through using these skills you can cut down on, if not eliminate it. And if you've never been on it, you may never need it. And if you are on antidepressants, that's a whole different ballgame. And we'll talk about depression and try to eradicate some of the fears and misconceptions. And also to, I guess, just talk about alcoholism or drinking as a method of self-medication and why that really isn't a good idea. Coming from a family with alcoholism in the background, I really believe it's a lot harder to overcome a drinking problem than it is to overcome a problem with anxiety. And I also believe that a lot of people, well, we know that 50% of those who abuse alcohol are self-medicating for anxiety. So if you believe yourself to be one of them, then it's really a good thing that you're going through this program. And it's all about, as Dr. Fisher and I talked in our interview, about moderation and about cutting down gradually. If you try to go off caffeine or if you try to go off alcohol or if you try to go off your medications cold turkey, it's a bad idea and you will feel bad and you'll have side effects. You don't ever want to alter a medication without talking to your doctor. So you're going to hear a lot of great testimonials and stories tonight about medications, but don't ever just say, well, you know what, that's it, I can stop taking this, because you can't. You need to go off gradually. If you're not on medication now and you don't feel you need it, great, good for you. If you're on an antidepressant right now and you're feeling guilty about it, you shouldn't be. So let's talk about all these things, and I think we'll start with Pam. You've been on medications.
Right.
How many different, roughly?
When I first found the program, I was on 5 different medications.
I'm assuming anti-anxiety medications,
yes,
antidepressant medications.
And I really freaked out. He put me on a psychotic medication.
Antipsychotic medication?
Yes. It was called Trilofan.
Mm-hmm.
And I was seeing a psychiatrist at the time, and anything I would tell him I thought I had, he would medications when I started the Midwest Center.
Were you afraid of all those medications?
Yes. And it seemed like all I was doing was taking my medication. It wasn't really helping me at all.
Did he say anything about you really need to change the way that you think? You really need to change the way that you react and respond to things?
What really made me angry is I got the literature from the Midwest Center. I took it in to him, and he read through it, and he put everything down, and he looked at me, and he said, Pam, he says, you're a really nice lady. I'd hate to see you being taken advantage of. And thank God I didn't listen to him, because I went ahead and signed up for the program anyway. So he was not supportive at all with me going through the program.
Yeah.
But the great thing about it is after going through the program, it took about 5 months, but I was able to go off all of my medication.
Mm-hmm.
And at that point, I did go back to see him. And
what did he say?
Oh, he was really upset because
you were off your medication.
Yes, he was.
You didn't need him anymore.
He looked at me and he said, you know, Pam, he says, I don't understand. I was really excited about going off the Xanax because I was on quite a high dose of Xanax.
How much were you on?
I think I was on, it's been so long ago.
4 milligrams?
5, I think.
5 milligrams.
5
Wow.
milligrams like 3 times a day. I was on a very high dose.
Oh, you weren't on that much. You were on like maybe 1 milligram 3 times a day.
Right.
3 milligrams.
Right. It's been a long time, and I don't even really
5
remember.
milligrams 3 times a day.
It was a high dosage, but what was really great about the program is I started telling myself it's just my anxiety and it'll go away, and I felt so proud of myself when I could start feeling that way and talking to myself and not having to take the medication. I went off of it gradually.
Did you start by carrying it in your pocket and putting it in your purse so you had it with you just in case you needed it?
Yeah, I did that.
Talk about that.
I did that.
And then did you start forgetting that you didn't even, you just forget to put it in your purse, and you know what I mean?
Right. After a while, I didn't need it, and I felt so proud of myself because I could control my anxiety by my thinking. To me, it was wonderful. So I went back to him at the end of the 5 months, and he looked at me and he says, well, why would you want to do that when you can just take a pill?
No.
Yeah.
Wow.
And so I just walked out. I never went back again, and I don't have a very high opinion of him at all.
Well, there are some really great psychologists and psychiatrists, thank goodness, and doctors, and we need them. And a lot of them are using this program, and that was probably a long time ago.
It's been 7 years.
And we've got 60, 70 therapists around the country, around the world now who use this, and a lot of universities and hospitals and physicians all around the country who use this program as the backbone of their treatment process. And I think the best thing to do is keep an open mind and know that it's your life, but you have to be informed. I can't imagine taking a drug of any kind without reading the literature, You need to know as much about that drug as you can. The only problem with us is that if you see all those side effects, you might start thinking you have them even when you don't. But you just need to be informed and know what you're taking and know why you're taking it and know that there's a way to help yourself and maybe you're someone who can't even sit still long enough to hear this information, then maybe you need to consider a medication. Or maybe you'll be going through the program and you really feel like you have a control over your anxiety, but energy, and you're crying a lot, you're having trouble sleeping, you're irritable, depression, and maybe a mild antidepressant will help you move faster through the program. So it's really a decision that you have to make with your doctor. And if you don't feel your choice, they work for you. Pat, you and I are good friends, and we actually eggs, and people with that's a joke. Agoraphobic people are people who are so anxious that they avoid doing things, and that's what we both were at one time. And people like us, though, make really good friends. So find a few and hang out with them if you want to have a good time. Of course, you're probably obsessed until you're blue in the face. But Pat, did you really mean that? Do you really like me? Yes, I really do like you. Are you sure? Yes. Do you like me? Sure. Do you really like it? No, I really do.
No, we really clicked right from the beginning, so I knew.
We did. Our husbands were friends.
And I was a friend with your husband, so
yeah,
we really clicked right at the beginning.
I want to talk, if you don't mind sharing, about the depression that you went through. And I know, we're segueing a little bit here. That's a television term. But, I was always afraid of getting severely depressed and really to the hospital, and depression, and you had been through a lot with your endometriosis and just a lot of different stressful things in your life, and you were overwhelmed.
My in-laws have been very ill with heart problems, and my mother-in-law had suffered from very severe depression.
Which I think
really being at the hospital and already having been through a lot of things, and with the anxiety, and then seeing her in the hospital, and it freaked me out.
It did, and she was going through some major treatments and things, and I think your what ifs got the better of you.
Right.
What if that would happen to me? And you really went through a rough episode, and I remember coming over and you and Bruce and I talking, and you were really upset, and we kind of decided that maybe you should go talk to somebody to the hospital for about a week.
The decision was I think the medication could have really helped me, but I was so sensitive to me to monitor. I would feel more comfortable about it. That was a really, really hard thing for me to do.
Because of the stigma, too.
Right, yeah, the stigma associated with it, plus, again, some of the things that my mother-in-law had been through, but again, she was older and had different things happening than what I did.
Right.
But
remember when I'd come in, not to change your, but I'd come to visit you, and we'd sit there and I'd start telling you all these skills in the program. You got to think this way, and you got to, and there'd get a little crowd be gathering around to hear. They'd be like, "What is she saying?" And it made me think, nobody's giving these people this stuff in here.
No.
I'd say, what are they doing in here? Well, they have a paint class. And now, not that they didn't have a therapy class.
No, they did, but it wasn't the material that you get through the program. But I think the one thing that I really have to say is, and what really made me make the decision about going ahead and going to the hospital, our home is on the river, and we have a boat, and it's a really great place in the summer, in the spring, and you and David had come over and your little girl, and I said, I can't even enjoy this. I said, I'm not enjoying anything, and this isn't worth it. And I remember thinking, I've got to do something about this. And I needed the medication to, as you
get out of that
mentioned,
black hole.
To get out of that hole so I could take all these things in and put them into use. And I don't want to, have anybody think if they have to take medication that they should beat themselves up over it, because some people need it. And I don't take any medication now. Yeah. But if I had to go back on an antidepressant, I would do it.
That's
You
right.
know, I don't. There's not a fear involved in it like there used to be.
And
you know?
thank God that it was there for
Right.
you when you needed it,
Right.
because you were so you were so caught up in your fear and your depression,
Right.
and you were just so overwhelmed and tired from it that at the time it gave you the strength to get your good thinking processes back and focus on the program.
Right.
But it was an important time for you, and now here you sit. How long has it been since you've been on medication?
Oh gosh, probably like 6 years.
Yeah.
Yeah.
So that's what's important to see, is that
Right.
just because you may get a diagnosis of depression, it's not.
This concludes side 1 of this tape. To continue, please fast forward and turn the tape over.